WGN investigates death in Illinois. Is it COVID or something else? We've reported on the accuracy of the state's coronavirus death count. Now new numbers show several thousand non-COVID deaths in recent months. We've tried to make sense of the dizzying number of deaths in Illinois.
Since yesterday, unfortunately, we received a report of 87 additional lives lost. Fortunately, we're reporting another 105 new fatalities. Unfortunately, this does include 146 additional people.
WGN Investigates is constantly reviewing state data on the number of deaths in Illinois, deaths from all causes. New numbers show from January 1st through May 15th, there were 6,230 additional deaths in Illinois than the average during the same time period over the last 2 years. Just over 4,000 of those were labeled COVID related. That means there were more than 2,100 additional deaths not connected to COVID. Here's what one expert told us last week.
Other part of these excess deaths that give me a lot of concern are delayed or deferred care. We've seen a decline anecdotally in patients presenting to the hospital for symptoms of chest pain, heart attack, heart failure, and stroke.
The Illinois Department of Public Health tells WGN the data does show there are excess deaths, and potential reasons could be deaths that were exacerbated by COVID-19, such as heart disease or other chronic diseases, although less likely there could be more COVID-19 deaths than are being reported. Health officials told us it will take months, maybe years of research to determine what precisely happened and why.
This is kind of like the fog of war. It's really hard to tell exactly what's happening in the middle of a pandemic.
As the city of Chicago moves to the next stage of reopening Wednesday, a renewed warning from the city's health director.
Deaths are on the decline, but we've already had more than 2,100 Chicago residents die, and unfortunately that will continue to climb.
She also revealed new information on who is dying from COVID complications.
92% of our deaths have been in people with underlying medical conditions, led off by diabetes, hypertension, lung disease.
1/3 of Illinois' excess deaths, as they're known, have not been classified as COVID-related. The state health department says it will likely be studying the effects of the virus and the lockdown for years to come.